Hi everybody, so I'm gonna talk about what type of things I do as a PCA. I've been in my hospital or in my position for the past 3 months. So I work evenings and nights. So for evenings, what I do is I would come in, I would grab the assignment sheet, I would grab Vocera, I would log in, I would go to the locker room, drop off my stuff, and then I go to one of the cuppies and then I sign in and I look at the patients that I was assigned to, and then I would also write some stuff down, and then I would go and look for the person that worked ahead of me so I can get the report from them. So the most important thing to do first when you get the report from the other PCA is to do your vitals. And then once you're done doing your vitals, make sure you chart that stuff in the room. And then once you're done with that, you ask the patient if they need anything. And then try to get all your vitals done, so all the 8 patients or 10 patients or however you have. Because after that, once the nurses finish with their report with another nurse, they might start calling you and they might ask you, hey, can you help me do this? Can you do that? And then we also have finger stick or blood sugars, which I wait for my evening. I do it at 4 p.m. So that way it gives me 8 hours for the next 4 hours of the blood glucose. And then for the nights, I wait till 12 a.m. because I come in at 11 p.m. And then also for the new admin, so like some of the rooms are going to be empty, and then the housekeepers, they clean the room up. So then they leave. And then when you go in, some of the stuff that we need to put in is we put Kleenex, we put ECG monitor strips, we bring one gown, we bring an SpO2, and then we bring a blood pressure cuff, we bring a chucks, like the pack of them, and we take one of them out, we put it on the bed, and then you make sure you zero the bed. We bring 2 canisters, and then we make sure we bring some tubes and anchors and the suctioning stuff. And then I also sometimes bring a basin and I put a brush inside of there. Make sure we put the bed low, and then make sure we bring the commodes. For night shifts, is just important for you to do your vitals, to make sure that you keep them comfortable, give them warm blankets if they ask for it. Oh, and then sometimes we have 1-to-1 safety assist, which when you come in during your first shift, it would tell you on the assignment sheet where you just stay in one room your whole 8 hours of shifts or whatever you want, and then you chart. If it's safety assist, you chart every hour on the computer how they've been, and if not, then you just help care for them, you do their vitals, you do everything for them. That's about it. Oh, and then ACHS means you take their blood sugar before they eat and before at night, so like 11 p.m. if it's night. And make sure you chart your daily cares, activity types, positioning the patient, and the blood glucose stuff. You tell the nurse, you call through Vocera, tell the nurse what the blood glucose is, and then you click a button on the glucometer, and then it charts for you. Oh, and then these are the things that I put on my report when I'm done with my shifts, is I make sure I tell the other person that comes in after me. So the patient's vitals, are they Q4 or Q8? And how are they assisted? Can they be assisted by themselves, or is it Q assist? And then how do they use the bathroom? Do they have a urinal? Do they walk to the commode? Are they incontinent, like they just go while they're in bed? Do they use bedpan? Also, is the patient ACHS? So that way the evening people would know, which is you take their blood glucose before they eat and then at night. Or are they just Q4 finger stick? And then last but not least is what type of diet are they? Are they NPO? Are they regular diet? And stuff like that. So that's all I've learned, and that's all that I do as a PCA. Bye.